Then you have the transverse arch, basically is the metatarsals, typically called the metatarsal heads. Right here. And let's see. We do a lot of orthotics in my office too, and this is kind of a more simpler one. But you can see what's called a metatarsal pad. I don't have one in here, but if you've ever seen them, it's kind of like shaped. Shaped like that, and it usually sits right here to help support the metatarsals for the transverse arch. And I'll bring in, next week, I'll try to remember, I'll bring in some samples of orthotics, because there's different things that you do with the rear foot and forefoot, things like that.
So that makes more arch, more.
The metatarsal pads would help support the arch. Yeah, it's just pushing up the middle right here. Because, I mean, basically this is a normal transverse arch. This would be a dropped arch. So you want to have that dome right here. So this would be the toe end and this would be the heel end here. So it would fit in there to help support the arch. So basically in the foot we have plantar flexion. As far as range of motion, we have plantar flexion, dorsiflexion. Now there's a lot of different joints into the foot. I mean, you can talk about each of the different the bones between all the different tarsals, so the intertarsal joints. But we're talking about the primary thing we're looking at is the ankle mortise, and that's going to be flexion extension. Okay, so in that, when we're talking about that particular joint, loose pack position, it's like if you just lift your leg up like this, your ankle's pretty much going to go into loose pack position. It's going to be not neutral, but a little bit of plantar flexion. So it'd be like, like this, about 10 degrees of plantar flexion. Okay. And then close pack is going to be maximum dorsiflexion. Because remember, we talked about the ankle mortise joint, it's wider at the front. So when you dorsiflex, that joint is in maximum contact. So there's more, it's tighter into the ankle mortise. And then capsular pattern, if the joint capsule is affected, it's going to limit flexion and extension, or plantar flexion, dorsiflexion equally. Right, so then the subtalar, and we'll talk a little bit, I've got some other slides that will talk more specifically about pronation and supination. But basically, the simplest way you can look at it is inversion and eversion. Is moving the foot. This is inversion like this, and then eversion. So just think of the sole of the foot, you're turning it towards the inside is inversion, and this is eversion. All right. So in this case, the subtalar joint loose pack position is midway between inversion and eversion. And then close pack is inversion and supination. And I don't think there's much in the notes as far as with gait, but when the normal gait is to land on the outside, the lateral surface, posterior lateral surface of your heel. So now you're in supination and the joint is more locked. Then you come forward and you go into pronation. So when you heel strike, you're striking on the posterior lateral surface of the heel. And then you pronate. And then at the end you supinate when you do toe off. Okay? So it starts out, so where do you think, if you're looking at the bottom of someone's shoe, and we'll talk more about wear and tear, but where would you expect the most wear to be on the shoe in a normal situation? Posterior lateral, so down here. Okay? If you see more wearing on the medial side, what would you suspect is going on with that person? Okay, more likely to have pronation. Okay, so now we have the ligaments. So What does that abbreviation stand for? I'll give you a hint, it's right there. What bone is this? What bone is that? What's the next bone right down below that goes into the ankle mortise? Talus. Okay, so we have this one and we have that one. Do they both go from the so we have an anterior talofibular and posterior talofibular. I guess the posterior is right here actually. Okay. So we name them by the bones they attach to, from the talus to the fibula, and in this case, since we have one in the back and one in the front, we have to call one of them the anterior talofibular and the other one's posterior talofibular. So then what would this one be? What's this bone here? What's that? Right. Okay, so if it comes up in any of the questions or something on the quizzes or something, you can't just abbreviate it, you have to give it a full name. Anterior talofibular, posterior talofibular, calcaneofibular. Now, on the medial side, there's a series of ligaments, but the name is just all kind of lumped together as a deltoid ligament. So you don't need to worry about any. You know, basically there's going to be names for each of these individual ones based on the bones that they attach to, but it's commonly referred to as just the deltoid ligament. And that's because of the shape. Like if we talk about a river delta, it's narrow on one side and it branches out, it's kind of basically this kind of shape. Except it's pointing down right here. This is the narrower part of the attachment and then it kind of bends out as it goes down. So then what would be the mechanism of injury to injure the deltoid ligament? Would it be inversion or eversion?
Eversion.
Right. Eversion, so turning out. So you're going this way, going to be deltoid, going to be doing this, which is the inversion ankle sprain. Okay. Which kind of ankle sprain is more common?
Inversion.
Yeah, inversion. Okay, if you look at the tibia and the fibula, which one extends down more distally? Fibula. So are you going to have more motion in inversion or more motion, inversion or more in eversion? Inversion. So yeah, most commonly you're going to get your ankle sprains like that. Inversion ankle sprains. And then again here we're talking about the tarsal tunnel where behind the medial malleolus you have these different structures that go through. There's going to be nerves and tendons, and we'll talk more about that. And then if you're just looking at the anterior part of the joint, you have the joint capsule. And then, anybody know what that one stands for?
Anterior, inferior, tibial.
Right here. Okay, so we have to call it anterior because there's things on the back, and then you also have to call it inferior because there's connections at the fibula and the tibia at the top. So anterior, inferior, talofibular ligament.
Where's the tibiofibular ligament?
Let's say, tibia, sorry. Anterior, inferior, tibiofibular ligament. So I think in the notes it just has all those abbreviations, so just make sure you fill all those in so that you know the exact name of it.